I am Dr. Jacklyn Thompson, a family physician and a lifestyle medicine diplomate in the making. I'm going to be talking about family health and fitness. What do we mean by a healthy child? A healthy child is one that is emotionally, physically, psychologically, and spiritually well. It doesn't just mean that the child doesn't have any disease or doesn't have any sickness or infirmity. When we talk about fitness in a child, we mean that a child is able to go about his or her daily activities such as jumping, running, exercising, and going about their normal house chores without getting unduly tired. Usually, a child is supposed to be able to engage in physical activity for at least 30 minutes before they are tired. We don't want our children to grow up to become unhealthy adults who have diseases such as diabetes mellitus, hypertension, obesity, and also cardiovascular diseases. It's very important for us to get our kids to be active. Why? Because WHO has found out that the inactivity prevalence in children is about 81%. Girls have been found to be about 85% inactive, and then boys are about 78% inactive. Children also need to be spiritually well. And what do we mean by this? We need to teach them the Word of God. We need to teach them whatever religion it is that we know is good for them, that we are practicing and we are benefiting from. We have to introduce that to our children so that they are spiritually sound. We need to teach them how to pray, and we need to teach them how to get in tune with their God and know God for themselves. And it's also important for us to send them for well-being checkups annually. This will enable doctors to find out if there's any hidden disease that can be screened for, caught early, and then dealt with before it goes out of hand. So we want to ensure that our children are getting a good diet. What do we mean by a good diet? It means that our children should be well fed with the right amount of fruits, vegetables, nuts, peas, and legumes. We also need to cut out sugary foods such as ice creams, carbonated and sugary drinks, and then we also need to cut down on the fast food such as burgers, fries, and pizza. We also need to get our children to be able to sleep well, and the sleep has to be what we call a restful or restorative sleep, such that when the child wakes up from sleep, they feel very rested. Children below the age of 5 need about 10 to 13 hours of sleep within 24 hours, and children up to the age of about 10 to 12 need about 9 to 10 hours of sleep in the 24 hours. Apart from ensuring these, we also need to make sure that we send our children for annual wellness checks. This will enable diseases to be screened so that they are caught early and then something is done about it before it gets out of hand.